Right. Good afternoon, all. Thank you again for joining us. And we are back with another very experienced and very, in fact, I will say, dynamic Vaidya with us, Dr. Surabhi Vaidya. And she is basically, apart from an Ayurveda consultant, there are very few doctors in our fraternity and community having the knowledge and insight of various other related fields. I remember our PM in the last speech also said that when we need to convey our Ayurveda and the Indian system of medicine to the entire world, we need to convey in their own language. And these days, we all know that anything going through the clinical research, clinical trial, pharmacovigilance, all these aspects are very much required in Ayurveda, but there are very few doctors in our field who are aware about all these concepts, the fundamentals. And Dr. Surbhi is one of them. So we are very much pleased and honored to have her on our platform. And I request all of you to just go through her profile in detail today, which she will be explaining on her own. And she can add value to many aspects to all of you. Be you are a leading clinician, you want to structure your clinical data, pharmacovigilance aspects are there, be you are a company startup mid-level or any level of company, she can play various roles as an advisor, and we are already in discussion with few companies to get involved and take it forward from here with Dr. Surabhi. So please go through her profile today, and accordingly we can take it forward. She will be sharing her contact details also at the end of session, so you all can contact her directly and take it forward from here. Thank you so much again for joining us, and thank you again, Dr. Surabhi, for giving your valuable time to our platform. We are looking forward to have many more sessions in future as well, because you are very much diversified in knowledge. But today we are just focusing and looking forward to have a detailed introduction of you and your experience.
Yeah. Thank you, Dr. Piyush. Thank you for such a lovely introduction. And thank you, Indian with the platform. Thank you, Indian with the platform, to give me this opportunity to flaunt my skills in the very broad platform. So, friends, as we all know, as per the Ayurveda doctors, we start with Swasthasya Swastharakshanam and Aturasya Roga Prashamanam. That is the motto of Ayurveda. That is, we are into preventive field, and we are into treatments also. So, considering this, we have Charak Hill Solutions, our pain management and Ayurvedic Panchakarma Center in Thane West, Mumbai, Maharashtra. So, what we deal with? So, in our center, we deal with traditional Panchakarma. I have learnt it from Kerala itself. Then we have Ayurvedic cosmetology, we have pain management. In pain management, along with this traditional Panchakarma, we are offering Cairo, we are offering osteo, cupping, moxa, and there are 10 various types of pain management techniques. So, instant pain relief is possible with the help of Ayurveda and these pain management techniques. Then we deal with preventive healthcare, leech therapy, which is now again regaining its charm nowadays. Then correction in lifestyle management disorders. Nowadays, it's a fact that if you have diabetes or you have thyroid, you have to take medicines for lifelong. But Ayurveda do provide solutions that we all know. We have Panchakarma, a very effective tool. But what after Panchakarma? If you misbehave, or if there is Prajnaparad, which term we use for the mistakes we do in our life, so that recurrence of disease is always there. So, with the help of Panchakarma, we detox first and then we give the guidance to correct their lifestyle. Then weight management, it's a big issue. In kids also, we are seeing obese and overweight patients. So right from their day-to-day schedule, dinacharya, rutucharya, ahar, vihar, and then aushadhi, we manage the weight. Treatment for infertility. So manasya to garbhadharana, we all know. That part is lacking nowadays. So we counsel on that part also. Pre-conceiving counseling is there. Then Garbha Sanskar. moxa, acupuncture, acupressure, osteopathy, bandha chikitsa, and cupping. These all things we do under one roof. That is in Charak Health Solutions. So this is my little intro. It is MBMS and MBA in Clinical Research. Expertism is we don't waste patients' money on diagnostics. We do Nadi Pariksha, we do Prakriti Pariksha, and we do pH testing of saliva. So we get a gist of the patient, and again from the date of birth of any patient, we know prakriti of the patient, which is either it is amladharmi, ubhaydharmi, or it is alkaline, means amla or basic. Aisa, that we come to know with the help of pH testing of saliva. Expertism, apart from the treatments, means panchakarma, medicines, we give counseling, we give corrections, means functional medicines also we provide with the help of various forms and online consultation. So expertism is in reversal of diabetes, PCOD, thyroid, anorectal disorders, and treatments of infertility. Sometimes you don't need a huge treatment for infertility. Some basic corrections are done, and if the pitta prakriti is there, then you have to just specify that pitta. It is that much easy sometimes. So my journey started with my BMS at Government Ayurvedic College, Nagpur, in 1993. Then after marriage, I shifted to Thane. I always wanted to do this Ayurvedic practice, but that time also in Thane, it was not that easy to start the own practice because of brains. Those were quite high. So I was doing various jobs. As we all need to have knowledge of modern medicines and modern diagnostics, we should be able to read this various reports which have brought to us. So I have joined various hospitals. I worked as RMO there. Side by side, I kept myself updated with the help of some herbal cosmetology program, then diploma in nutrition and diet planning, certificate course in yoga, then content writing. All these things I used to do side by side. And I have done various jobs also, as Dr. Piyush mentioned, that I have very much diversified experience. It is because of I have worked in various hospitals and with various doctors. I have worked. Then apart from these things, I was a center manager at Zai Wellness Center. It was a zero clean pharma project. Then I did when I did my MBA in clinical research, I got placed in TCS into pharmacovigilance department. At pharmacovigilance department, you need to have this expertism or knowledge of guidelines of various territories like European territories, US territories, Indian territories like this. So I got exposure to clinical operations. I work as a CRC at an rheumatologist. Then I was senior drug safety associate in pharmacovigilance TCS. Then I was technical assistant to India director for one MNC, Indus Life Science. And main thing, I was a helping hand to Dr. Pai, a cosmetic surgeon. There we used to conduct some seminars at five-star hotels for foreigners in cosmetology. So all this experience it got me updated in computers, in using various softwares. My English got improved because of all these things because I worked in that much varied areas. So when I was at TCS, at that time I realized "Okay, I need to do this is the right time. I need to do something for Ayurveda." So in 2013, I quit my job. I joined as a CMO in Ayurveda Specialty Hospital, which is run by our guru Dr. Satish Nambudri. It was at Bhiwandi. There I got full exposure of all the Kerala treatments, all the protocols, and I would able to mention it in clinical trial language like protocols, then inclusion area, exclusion criteria, all these things. And from 15 onwards, I have opened my own pain management and Panchakarma center, Charak Health Solutions. So here we offer absolute pain management techniques, that is herbal cosmetology and Ayurvedic Panchakarma. In absolute pain management techniques, As I mentioned earlier, we include Ayurvedic Panchakarma like Basti, Sthanik Snehan Svedan means local massage and oilation, and with this we coupled it with osteopathy, chiropractic, Bandha Chikitsa, Moksa, cupping, all these things. In cosmetology also, we have modern machineries. When we talk of hair fall, we need to explain the patient how many roots are there in that particular area. For that, we need some microscope and some pictures of that scalp. So, with the help of microscope, we take the pictures, photos of that area, so that next time when the patients come, we can see the improvement, and then it is convincing. Apart from this, we give internal medicines also. In cosmetology, we include hair treatment, skin treatment, and figure correction treatments. So all these things are measurable. You can measure how much inch loss is there. You can measure how much hair fall you are able to stop, or how much hair growth you are able to keep. And this skin care, skin is obviously you can find out that skin glow or reduction in pimples, whatever it is, what are the criterias of the patients that we can easily jot down. So these all things are I am able to do it with the help of clinical trials. So we shoot before treatment pictures, then we take after treatment pictures. In case of pain management, we take before treatment video, means how the patient walks. Is there any trauma in his lumbar region? What is the reason? What is the muscle weakness? Where is the muscle weakness? What we need to target? All this is noted on the case paper, as well as in the video. We take all the details, and after 21 days session or 14 days session, we give after we shoot after treatment video, wherein patients are able to see the improvement areas, and we note it down on the case papers also. It is for documentation purpose, so that in case down the line after 4 or 5 years, if you want to publish any data, any studies, we are equipped with our data. Then we are giving treatments for thyroid, hormonal imbalance, obesity, diabetes, and COPD. That is chronic obstructive pulmonary disease. In rainy season, we find in Mumbai area a huge spread in this disease. Apart from this treatment, we are specialized in anorectal disorders. That is piles, fissures, and fistula. We get lots of patients who have done surgery and the piles fistula is relapse, or patients with first degree, second degree piles. At Charak Health, we treat patients till third degree of piles. If total prolapse is there, then no one can treat it. Only surgery is the solution. And we have developed some DIY, that do it yourself kits. In that, actually, this piles, fissures, fistula, it starts with your digestive system. When your digestive system is not good, or you drink less water, stools are hard. And when you try to pass the hard stools with pressure, that anal muscle at first degree, second degree, and third degree, it tried to come out. So, while treating piles patient, we need to treat digestive system. So, we have proper medicine, in-house formulation, manufactured from third party and FDA approved. That is Arshori. Then we have some powder for seeds bath, and after that we have some ointment for local application. Some Anuloman oil. Yeah, you might have heard. It is a Panchabhotik product. It is prepared through Panchabhotik formulation. Anuloman oil with the help of and in the combination of Arshori, it gives a very good effect on your stools. Stools become hard when the intestinal flora is acidic. This Anuloman tail, it changes the intestinal flora from acidic to alkaline, and the stools become soft and supple. and then it is very easy to pass. Then defecation is normal. If you are able to pass the complete stools, then the patient is free and patient is happy. And if it is not the case, then we have all these kits. We have all these medicines which are in-house prepared. We give treatments for 7 sessions, once in a week, like these 7 sessions, and then for maintenance, some medicines are there. And within 3 months, within the span of 3 months, patient is totally free from any type of anorectal disorder. If fistula is there, we have leeches. We apply leeches at the end of the compact end of the closed end of the fistula. Leeches suck all the impure blood and patient is totally pain free instantly. So all these practices we are doing at Charak Health Solutions. Then this is a gift of our COVID situation. At that time, we have developed this immunity booster kit. In that, we have some oil for nasal application, some oil for mouth gargling, mouth aulation therapy we call, some medicines to consume internally, and we have developed some Dhumavarti. Means apart from nasal application, we are giving Dhumavarti, Dhupan Kriya. It is very easy with that herbal cigar. So we used to that also. Now, with all this experience, I would miss the journey is now on online also. We provide online consultations. We have patients from Japan, London, Thailand, and I am looking for the whole world for my online consultation. We're expert in conducting presentations at various CME from Doctors Association, and we can present any company in CME or in workshops. We can give product training. I am looking for the companies who can include me in their clinical trials, wherein we can mention inclusion area, exclusion criteria, all these parameters we can set with the help of a team of doctors. Then my expertism in pharmacovigilance, and I'm well acquainted with regulatory guidelines of various countries, and I wish to be a part of clinical trials of Ayurveda medicines in India. I'm a content writer, and I'm writing articles, I'm writing blogs. On our website, my blogs are updated. I'm working with some French company to have their as their content writer for their juices, various juices. This is our website, and you can go through our website. You can see our blogs, and you can see our Facebook page also. Thank you.
Thank you, ma'am. Nice session, ma'am.
So, Dr. Piyush is there.
No, no, no. Sir is not there.
Okay, so it is still live or